Hello, my name is Julie Ramsey, and welcome to Government Health Insurance. Key points in this session is what's the difference between Medicare and Medicaid. They sound a lot alike, but they're two different programs. Medicare, think of care for elderly. Medicaid, they need help in pain. Let's walk through Medicare. Who is eligible for Medicare? Well, there are three groups of individuals. When you become 65 or older, you're automatically enrolled in Medicare, or you've been receiving Social Security disability benefits for 2 years. You may not be 65, and you can be on Medicare if you meet this qualification. Or lastly, you have permanent kidney failure, then you can go on Medicare. Now, there's different parts to Medicare. Very briefly, Part A pays for the hospital. Part B pays for the doctor. Part C is known as Medicare Advantage. And Part D pays for prescription drugs. Now, A and B are purchased through the government, and C and D are purchased through an insurance company. Now, let's get into some of these details. Medicare Part A. Part A is mandatory. I mean, you automatically get it when you're 65 years old. What does it cover? Well, we said it covers the hospital. It would cover things like a semi-private room, nursing services, the operating room, labs or x-rays while you're in the hospital. It covers blood, but there's a 3-pint deductible. So that means you buy 3 and then you'll get the rest for free. When you go to the hospital, the insured pays an initial deductible, and then you're covered through day 60. Medicare pays 100% for those 60 days. You paid the deductible. Now, if you're still there day 61 through 90, the insured pays a daily copay. Now, I'm not interested in the amount. I just want to know when this person would have to pay. After the 90 days, so every time you go to the hospital, that 90 days always replenishes. You always have it. You pay your deductible, you're good for 60 days. Day 61 through 90, there's a copay. Now, after the 90 days, you can tap into what's called your lifetime reserve days. And you have 60 lifetime reserve days. In order to use these, the insured pays a copay, and then Medicare pays the rest. However, notice these are called lifetime days. That means once they're gone, they do not replenish. Part A also has a skilled nursing benefit, and it's a 100-day benefit. And it says, as long as you spend at least 3 days in the hospital, then you would have a 100-day benefit in a nursing home. All right? Now, it has to be the same reason as to why you went to the hospital. You paid your big deductible, right? That's why they want you to go to the hospital first. I'm there for at least 3 days, and then I go to the nursing home. Well, when I go to the nursing home days 1 through 20, I don't have to pay anything. Why don't I have to pay anything? Why am I good for those 20 days? Because I just paid my big deductible because I had to go to the hospital first. If I'm still in the nursing home, days 21 through 100, there's a daily copay that I will have to pay. Now, after day 100, there is no more coverage, and I would have to pay for that out of my pocket. Additional coverages, Part A would pay for home health care. That's when somebody would come to my house, or hospice. Hospice is when someone is terminal. So that is Medicare Part A. It's mandatory. Now let's talk about Medicare Part B. Part B is optional. As a matter of fact, if you want Part B, you're going to have to pay for it every month. But this covers the doctor, the surgeons. It has an annual deductible. That deductible amount does change every year, so we don't need to memorize that amount. But once I pay my deductible, then it's an 80-20 coinsurance, which means I would be responsible for paying 20%. There's also no maximum out-of-pocket limit. Parts A and B you get through the government. Now let's talk about Medicare Part C. We know with Medicare Part C, I get that through an insurance company, but this is called a Medicare Advantage plan, or also known as Medicare Plus Choice. You see the C in choice? That's where we got Part C. It's known as the HMO option, which simply means it's a group of doctors that have their own network. Now, people enrolled in a Medicare Advantage plan, Part C, don't need a Medicare supplement policy. And we talked about those supplemental policies in another session, because the Medicare Advantage plans usually provide most of the same benefits that are provided by those Medicare supplement policies. Medicare Part D. Again, this is also issued through an insurance company, but that covers prescription drugs. A lot of our seniors are on lots of prescription drugs and need this coverage. So that is Medicare, all right? Now Medicaid, see that word aid? They need help in pain. Medicaid is a welfare health care program, and it's established by the federal government, but is administered by each individual state. Well, what does it cover? It covers just about everything. It covers the hospital, the doctor, the nursing home care, typically with little or no out-of-pocket. Again, these folks need help in pain. So those are the differences between Medicare and Medicaid. To recap, we said Medicare is care for our elderly, all right? Or if you've been on Social Security disability for 2 years, or if you have permanent kidney failure. Medicaid is a welfare program to help the people that truly need the help. Thank you for joining me today in Government Health Insurance.